Hey guys, Tony Maritato here, licensed physical therapist. Welcome back to the channel. So in an effort to drive up subscriber numbers, I'm going to try and focus on answering subscriber questions from the YouTube comments below. Now, I don't know if everybody that is a subscriber shows up as a subscriber in the comments, but a few of you guys have this little red circle next to you, and so I know that you are subscribed to the channel. So Peter, recently, he's the most recent comment that I had from a subscriber, was asking, he is 6 weeks post-op. He saw his surgeon yesterday, and the surgeon said he was ahead of the game. He felt like he was lagging behind because he's still lacking 6 degrees of full extension and his flexion is at 101. But what he's asking is, should he begin working on strengthening, or should he wait until he has a little better range of motion? So this is a great question, Peter. I am not the kind of therapist that likes to differentiate or separate strength versus cardio versus range of motion versus endurance. I tend to just lump everything together. Now, there's absolutely a time. If I was training an elite athlete, I know that there's detriment to training strength when I'm trying to train power, because strength is different than power, power is different than endurance. So we would go through cycles where we'd focus on one component. But for most normal human beings that aren't elite athletes, we can kind of combine everything together. So what I would tell you is, when you're working on your range of motion, rather than simply doing some of the lower level exercises like a heel slide or like prone leg extension, I would include some strength components into that. So maybe a squat. A squat could be sitting and standing from a chair. Most chairs are about 19 inches from the top of the seat surface to the floor. So if you're able to independently sit to stand from that level, then I would lower it. I might go from a standard chair to a soft couch. I might go from a soft couch to a 12-inch step stool, eventually progressing to 10 inches and 8 inches. For most adults, anywhere in the range of 4 feet 5 inches tall to 6 feet tall, getting yourself to sit on an 8-inch step. And think of normal stairs. Normal stairs are about 7 inches in height. So if you could sit on the bottom step and then return to standing from that bottom step, that would be a full depth squat. That would work on your range of motion. Now, I'm going to tell you right now, at 101 degrees of flexion, you're not going to get to a squat depth that low. But even if you're working on the second step, going from sit to stand on the second step, we're looking at about 14 to 15 inches. We can work the squat, we can work the strengthening, and we can work increasing the range of motion. In fact, I've got a video of a female patient that I'm working on this exact exercise on. I'll see if I can find it and put it up here in the card so that you can reference it. But yes, combining strength with range of motion, I believe, is one of the best ways to continue to improve range of motion. You're better than 90 degrees of flexion. You're better than 10 degrees of lacking extension. You are doing really well. Pat yourself on the back, celebrate that win, but absolutely start to progress the pure range of motion exercises into a combination range of motion and strengthening exercises. But like anything, strength requires rest and recovery in order to experience the gains that you're looking for. You can't necessarily strengthen a muscle every 24 hours. Now, I don't think you have to go old school and say, well, I have to rest the muscle 48 hours before I strengthen it again. But I think there's a sweet spot, a Goldilocks. Not too much, not too little, something in between. So if you find that you do a strengthening exercise that also works on range of motion, like a full depth squat, and maybe 8 to 10 to 12 hours later, you're feeling good and recovered and feel like you can do it again, awesome. That's perfect. That's a great intensity. If you feel like you did so much that it takes you 48 to 72 hours to recover before you can do that exercise again, that's too intense. You need to back off the intensity, and you need to find what your body can handle to stimulate improvement while still allowing an adequate recovery. Adequate recovery in my book would be 12 hours to 24 to 36 hours at the longest period. That's where you should be able to repeat the workout, repeat the exercise, repeat the activity without increasing your soreness. So Peter, I hope that was helpful. Thank you so much for subscribing and supporting the channel. Feel free to post more comments, questions, and anybody else that's watching. Guys, I'm going to share a link to a video right there that I think YouTube might think you want to see next. So check it out. I'll catch you guys on the next one.